So, hello everyone. This is our research group meeting for August. I know that many of you are pretty busy at this time of the year, and I hope that everyone is starting a good fall semester. So we have a familiar face as our speaker today, and she is the co-chair of this group, Dr. Luz Huntington-Moskos, and I really appreciate she was willing to provide this presentation for us. Luz is an assistant professor at the University of Louisville School of Nursing. She's actively building her research program, which is focused on intersection between adolescent health, environmental health, and health disparities. Her research focus currently is on developing report-back strategies to promote genomic and environmental health literacy and to develop adolescent-led interventions to promote health behavior change. So she has completed a postdoctoral research training on radon and secondhand smoke exposure with the University of Kentucky. And also she has a long-standing interest in promoting adolescent health. So Luz and I were in the same PhD program, in the same university, and she was, I think, a year or so ahead of me. And I remember from the very beginning that her passion was adolescent health, and she was looking at tobacco exposure at the time and the cardiovascular diseases and hypertension in adolescents. So she has kept that focus. It seems like it's been a passion since she was a teacher in a high school, and it's just she's building on that every year, and we are so proud of what she's doing. And I would like to welcome you, Luz, and just give it to you. Go ahead.
Thank you, Azita. I like the introduction. You're correct. My focus has always been adolescent health, and through my interactions with you as a colleague and other senior faculty, including Ellen Hahn and Barb Polivka, I've really moved into an appreciation for the impact of environmental health on youth. So today my presentation will be focused on the idea of report back, sharing research findings. In genomics, they often call it return of results. So today's presentation is entitled How to Personalize the Report Back Process to Prompt Action. So this talk is shows you kind of the path that I've gone through to kind of appreciate the power of report back and how my own work, guided by some senior faculty, is trying to move firmly into marrying the idea of report back and adolescent engagement. Next slide, please. So today I'm going to talk about 3 projects and the beginning and the effort I'm putting into the 4th project. So I will discuss a systematic review that I've worked on with Dr. Barb Polivka. The second is a lot of the work that stemmed and started from my postdoctoral experience at the University of Kentucky. And then the third is my work with Barb Polivka here after I became an official junior faculty member and assistant professor at the University of Louisville. Next slide. So here is my introduction. Next slide. I always think it's very important as a nurse scientist in particular to talk about the practice, the clinical practice that led me to becoming a nurse scientist. I'm very interested in youth and health disparities because I've had the privilege of working in some other under-resourced communities in inner city Baltimore and on the Navajo Reservation in Arizona. So the struggles, the everyday barriers to health, the full capacity that I think sometimes is the potential isn't fully realized for what adolescents can do and how they can contribute. I think that's all led me to want to be a nurse scientist that focuses on the environmental well-being of adolescents. Next slide. And again, as Azita so aptly pointed out, we were both together at the University of Alabama, Birmingham, where actually Azita led the way for interest in environmental health and environmental exposure. And then I was lucky enough to become part of a team, the Breathe research team at the University of Kentucky, where I spent time focusing on indoor air quality in the terms of radon and secondhand smoke. Next slide, please. This is, as an assistant professor, this is how I try to articulate the work that I'm trying to do and how I see it move together in time. So I'm very excited to continue working in tobacco use and secondhand smoke, because I think health behavior is a really important sort of focus in environmental health overall. And where I live, what region I work in here in Kentucky and Indiana, tobacco is still an important exposure that we need to work with regularly, particularly now with the onset of e-cigarettes and the idea of secondhand vapor and the chemical exposures that result from that. I'm interested in sharing these reports, these results, so that individuals can take steps for individual action to improve their environment, particularly since the indoor environment is an unregulated space. As adolescents move into adulthood, they need to kind of solidify this understanding of environmental health and how exposures and lifestyles together and their own unique genomic makeup can impact what risks they have and how they can react and work with them and move forward in a healthy environment. And then, of course, I just think adolescents have a lot of capacity for learning and changing and growing and a growth mindset. And I think that's an ideal time to kind of solidify some of these environmental health behaviors. Next slide. So I'd like to just provide a little bit of context for those that may not be exposed to the concept of report back regularly. Next slide. This probably was the paper that really got me hooked on the idea of sharing research results to promote the concept of environmental health literacy. And this is really a daunting concept in some ways, because to be environmentally health literate in all areas of environmental health is a very tall order. So we're looking at the scientific portion of it, the cultural context with environmental health occurs. We're looking at the technology that impacts it and maybe the result of exposures. And then we're just looking at the way we communicate this information. So this full, complete, large diagram kind of shows you all the things that we may consider when we're trying to build environmental health literacy. On a practical level, it's hard to get people to understand where all the exposures may result from. So are you thinking about indoor air quality? Are you thinking about outdoor air quality, your personal care products use? Are you thinking about electromagnetic exposures, or are you thinking about PFOS and PFOA in your water, or radon in your water or air? It's the level and the number of areas where environmental health can be addressed is vast. And so finding a way to bring in these conversations in a way where people feel empowered is challenging and exciting. Next slide. So these are some of the everyday lay scientist, newspaper, lay media references that I see pop up because this is a particular interest to me, and I keep my eye open for this. But there was a recent article in the not too distant past where there was an opinion piece about really using the Detox Me Action Kit, which is available through the Silent Spring Institute. They have a crowdsourcing experiment that they're doing that people are voluntarily paying to see what kind of exposures they may have in their own urine. It's frozen and sent back to the Institute. So just the idea that we're sharing these sorts of results and seeing how it could captivate people's interest and promote and prompt them to change behaviors and products that they use. So the article that's on the left side of your screen is one that was written by Julia Brody, who is part of the Silent Spring Institute. They're an institute that is fully dove into the idea of giving back exposure results and just talking about the benefits that they've seen for their research participants and how it's grown and changed over the years. Next slide. The same institution has put together even resource manuals and templates to use for researchers who are also interested in making their participants a true partner in understanding what they're studying and the benefits that can come from those results. Next slide. And then finally, this was a big moment when the National Academies of Sciences, Engineering, and Medicine released this report on returning individual research results to participants. If you were lucky enough to participate in the webinar for the launch of this report, you saw that the committee that was involved did a really nice job of trying to bring together the return of results perspective with genomics along with the report back of environmental health. So they brought the knowledge from both of those areas that kind of have been growing and maturing and evolving in kind of separate domains, but trying to bring that all together in one report. It's really very interesting, and they really did a nice job of saying, hey, we need to talk about this ethical piece, what's ethically best for people, and really falling on the side of we have to respect the fact that by and large, our research participants, our clients, our patients, they want to know about their results, and they have it's ethical best practice to keep them involved. Next slide. So I'm going to begin talking about 3 projects that I'm working on with a number of colleagues in the area. They are both guiding me and helping me kind of craft my ideas to kind of see how I can bring this idea of report back effectively to adolescents, and particularly adolescents with asthma. Next slide. So the purpose of this was a systematic literature review. As you can imagine, it's great to go out there and see, well, what have people done in the area of environmental exposures and report back. So we really wanted to take the time. This was done with Barb Polivka and one of our undergraduate students to look at the existing literature, to see where the gaps in the literature might be and what kind of lessons learned or best practices that we can report on from that existing literature. Next slide. So we looked at 6 different databases. We didn't put any time limitations on this because the idea of report back is fairly new, and we wanted to make sure we were able to capture all the existing literature. We stuck to keywords that really honed in on the environmental exposure piece. So we weren't really capturing or seeking to capture return of results with genomic information. We were very much trying to stay within the realm of environmental health. So we stuck to environmental risk communication, report back, and we kind of combined report back with environmental exposure or biomonitoring. And the next slide will show how our results kind of panned out. Next slide. So here we found a substantial amount of information. Some of it was more case study, lesson learned articles, and they seem to focus on air quality or exposure to chemicals in the home. We saw a nice sort of distribution, and we got a number of articles. We found 72 non-duplicated articles, and after we looked at the exclusion criteria, we needed it to be in English. We didn't want book reviews. We wanted to make sure it was the return of exposure results to actual research participants. We were left with 22 articles to review. Next slide. So again, this kind of shows how the breakdown. We had 204 articles, and we applied our criteria, and we were left with 22. Next slide. So we learned some interesting pieces that in hindsight maybe seem a little obvious, but it's nice to know that there are researchers out there really talking about how this process works and how it's received. That's where the literature is right now. How is this report back process received? What might be some pitfalls that people are experiencing? That's what we found in the literature. So we know that among our study participants, there's a general lack of understanding for these toxins and how they might move into the home. A lot of times people would talk about how they felt their home was a safe haven, and they were surprised to see the number of exposures that they could experience in the indoor environment. It became very clear that it's important to show some context. We know that science literacy in our nation is something that we need to contend with, just like healthcare literacy is important. And so when we are talking about environmental exposure results, we need to make sure that we're providing a context, a comparison for people that aren't always dealing with scientific results, so they can put it in a context that makes sense to their life and to the behavior choices that they make. So that became pretty important. And also, we have, as researchers, you have to deal with the uncertainties that may be present because a certain chemical or a certain exposure is not fully studied. So finding a way to communicate these ideas to participants, research participants, that we don't know everything, but this is what we do know, and this is a way to take a precautionary stance with exposures. Next slide. We also learned about when we looked at the literature, we also learned about how to present information on different sources, how it was able to build awareness, and when throughout the timing was a factor, when research participants could receive their results, that having a good timeline and staying in touch with participants was important so that they didn't feel they were forgotten or their results were never returned and they weren't really part of the research venture. So and that goes back to many of these studies are CBPR, community-based participatory research, or have a strong community engagement. It seems to be an essential component where you have this strong connection, this good retention plan, as I just talked about, Barb, with good contact with your group and your sample and your research participants. Next slide. So we talked about the timing being critical for report back. It must be considered. We need to think about the changes in environmental risk perceptions. So people's idea of environmental exposures may be growing and adapting and changing with these interactions, and that's important. And also the community context. So number one, what are some cultural influences in that community that may influence how you provide report back and how you interact with that community? And then also, what kind of preferences do communities or individuals have for how they receive learning materials? Do you need to have that one-on-one conversation for good questions and answers, which appears to be vital? How do you present information in fact sheets? How do you have discussions? And how do you do this in a way that's tailored to the community and their learning preferences? Next slide. So the takeaways for this particular project, to be most effective, you have to tailor to your community both culturally and their learning needs. You need to consider integrating interesting teaching methodologies, good visuals, good graphs, good ways to explain the context of the results. And you need to be okay with the uncertainty that may result from these results, because not all chemical exposures are as studied as others. There are degrees of variation and degrees of what we know about particular exposures, and we have to find a way to discuss that with research participants that keeps the conversation open and going and with good action to result from them. So one practice implication that we came together with was environmental health knowledge is imperative to have for healthcare providers, because really we need to find these ambassadors to help bring this knowledge out to individuals who aren't involved in the scientific enterprise and to provide good context for them to act upon. Next slide. And so here is one of the posters that we presented with the graphic on the systematic review. Next slide. And then I think it's important to mention that the National Institute of Environmental Health Sciences just this past December had an important meeting for those that are involved in the community engagement cores of the P30 centers that are across the nation. And they did make ReportBack one of their highlighted themes for one of these meetings. It just shows you that this is an idea, an effort that's growing, that NIEHS is behind and willing to support. And hopefully it's a trend that will continue in many different parts of our nation, in different communities with different age groups. Next slide. Okay, so onward to a different project, which stems from my time at the University of Kentucky. I'm still actively involved with the BREATHE team, which is bridging research and advocacy efforts towards healthy environments. So that's the BREATHE research team at the College of Nursing at the University of Kentucky. Next slide. So the mission is to promote lung health. This team is very interested in tobacco use and exposure, radon, secondhand smoke, e-cigarettes, rural and urban comparisons. So a lot of work is done for advocacy for communities and policy work and access to health services as well. Next slide. And this is important. My picture on this slide always kind of gets a little twisted, but in the area of when we're talking about Kentucky, radon is a very relevant topic and a very relevant exposure because in the geology that comprises Kentucky, we have some we have high zones of radon due to the karst geology that makes up some of the beautiful caves in our area. So we do know that radon is a threat throughout the United States. And along with the high smoking and tobacco use rates in Kentucky, you have a synergistic effect between radon and secondhand smoke that kind of work together to increase risk. So it's a very important topic for our state. Next slide. Even in Jefferson County, where the city of Louisville is situated, we have some interesting maps to share with local radon professionals have shared with us. So you'll see this is the city of Louisville, and on the right side in red is the eastern part of Louisville, which tends to be a higher income community. And then right along the 65 corridor and to the west side is traditionally a more low income community. And the map itself is very misleading because it looks as though the 65 east-west highway kind of divides the county very distinctly, and there appears to be no radon threat on the east side and plenty of radon threat on the west side, which I mentioned is the higher income area. When really there's a disparity in radon testing. We don't really have as much radon testing on the east side, so we don't have good data points. In theory, it's probably very likely that the entire map would show up red in terms of radon potential and the radon that would be detected in homes. But again, and those that work with radon regularly know that each home is unique, each home structure is unique, and therefore how radon may enter the home and move through the home will be unique for everyone. So testing is really advocated for every home. Next slide. So we were able to take some data from an R01 study funded with Dr. Ellen Hahn, and we wanted to look to see if the subsample of individuals that had children in the home, if they were acting to move on radon and secondhand smoke, and if they felt prompted. We used a model of the teachable moment, as well as the PAPM model of health behavior change, to see how people were contemplating any sort of health behavior change. And we really found that, understandably, that radon really isn't on the radar for people with children in the home. There's a lot more kind of imminent threats that people may be thinking about, such as accidents or injuries. And so we really have an opportunity to kind of raise awareness about environmental exposures for our young children who really may be more susceptible due to their small body weight, larger body surface area, where they may be kind of their close interaction to the ground, if they're like crawling and moving around and exploring. So we have some work to do in terms of just helping parents keep their own children safe in the home with environmental exposure. Next slide. The next study that we worked on together was really thinking about the idea of how synergistic risk was perceived. We were really interested to know if people were aware that secondhand smoke and radon exposure combined to what we frequently refer to as a synergistic risk for lung cancer. And we really wanted to see if that was kind of present in the data we were collecting. Were people aware of this sort of combined risk factor? And we found that there's work to be done there as well, where people are not often aware of radon in general, unless they've had someone who's bought and sold a home and had to put a new system in. That's usually where people were aware. And that we could do more work to educate the public on how these two environmental exposures combine to increase risk for lung cancer. In the state of Kentucky, this state is #1 in lung cancer prevalence, and we have high smoking rates. And as I mentioned in a previous slide, we have high potential for radon exposure. So it is an important topic for us to continue to look at in terms of improving health outcomes. Next slide. So here we were starting to have looking at some of the outcomes for this large R01 funded study. This was the 3-month benchmark, where we were able to show that we could increase the stage of action, which is really what we're looking for with ReportBack. Can we prompt people to do something about the results that they're given? If I show you that you have a high radon result, if I show you that you have a high air nicotine level, will that discussion in this study, they did a brief phone intervention, like we call it a motivational interviewing light, to get people to ask questions and to prompt them to make some change when giving results back. And we found at the 3-month level, at the 3-month benchmark, we were starting to see that at least we were moving people down through the stages of action. So it was a positive result, and we were excited about that portion of it. And the next slide. I just want to take a minute to share the model that was used. So this is the adapted teachable moment model. So we're thinking about the testing and the report back as the cueing event that you see in the middle of that screen. So when you're thinking about people's emotions, their health-related self-concept, their perceived risk, whether it's general or specific to synergistic risk, how is that cueing people to act on the results that they're given? And then on the far right side of the screen, you can see that we're trying to motivate the skills for behavior change and kind of impact people's self-efficacy. Next slide. So right now we're working on our third kind of paper or output for this study, where we're really trying to look at the process elements of ReportBack. So a lot of the studies that are out there right now are talking about the ReportBack, how it was done, and then how it was received by the individuals involved. So how did participants feel about receiving this information, and was the information confusing or well communicated? That's what the bulk of the literature is talking about right now. And in this study, we're really trying to see if there are process elements, if we can really talk about the process of sharing these results over the phone, how we decided to approach it. We have algorithms for homeowners and how we discussed portions of it. So we're going to really try to kind of illustrate that more clearly so that people have a better template of the process elements that may make ReportBack more effective. we're finding some interesting results too, because radon and secondhand smoke are very different exposures, although they're both related to air quality. Secondhand smoke is a behavior that may happen every day with a loved one or a family member in the home, and you have to establish smoke-free rules in the home, which requires a commitment on a day-to-day scene or stage. And that can be challenging if there's resistance among your loved ones. Whereas radon is not related to anybody's particular behavior. It is the structure of your home and the location of your home. And once you have enough money to have your home mitigated, which can be a contentious point because it's expensive, once you put it in the hands of the radon professional, it is more taken care of, and the ball is rolling, and you don't have to have this commitment over and over again to mitigate your home like you would to have a smoke-free policy. So we're finding some interesting differences simply in the exposure that we're talking about, and dealing with that in indoor air quality. Next slide. Okay, so project 3. With my senior faculty mentor, Dr. Barb Polivka. Next slide. She has been funded through the Institute of Aging for this asthma in older adults study. It's a 5-year R01 study that is meant, we're still in the process of collecting 18-month data, but we'll be finishing up the first 5-year cycle at the beginning of 2020. And this is an interesting study because it really wants to shine light on older adults and how their asthma disease process may be different or similar to all the work that's been done with childhood asthma. And this is a longitudinal descriptive study. So it's really, we need to learn what's happening. This information isn't out there, and it involves an important component of phenotyping, which will assist clinicians as they work with asthmatic patients who are older. So asthma is not asthma. We know that it is not one disease process with all similar symptoms. It looks very different in different age groups and results from different mechanisms. So we need to make sure we're not treating all patients the same. And this study is also very interesting because it has a unique focus on volatile organic compounds, which we also know is a very important exposure, or a cluster of exposures that we need to think about with indoor air quality related to different cleaning products, different air fresheners, all kinds of things that we do within our own home, creating unique mixtures. So with the use of this study, and because a good bit of 18-month data has been collected, we are looking as a team to look at some of the report back done with this group of individuals, being that they are 60 years and older, and what was effective with them. Next slide. So it's important, like I stated, that older adults have not been very well studied in this area. And so we really need to think about what are their triggers, unique triggers, how they can approach reduction of asthma triggers. And the nice part of this study is that it does have a longitudinal component. So behavior change is really important. In some of the studies with our systematic literature review, there weren't a lot of longitudinal studies. So you can't see that element of change where people prompted to action, which is really what we're needing out in the literature to help us understand how we can support that positive health behavior change. Next slide. So as I mentioned earlier, longitudinal and descriptive with adults over the age of 60 that are diagnosed with asthma, and very importantly, non-smokers, because as you may know, smoking is a very, very strong indoor contaminant and clouds up any sort of indoor monitoring you may do because it's such a substantial indoor pollutant. So this was done with non-smoking individuals. The home environmental checklist was used to collect data on what was happening in the indoor environment for our participants. And then baseline report back data was shared with evidence-based suggestions for reducing triggers in the home at the 9-month visit. So again, baseline information was collected, and then at the 9-month visit, a 1-page quick action steps that are evidence-based was reported, and then a more lengthy report was personalized for each individual. And then the nurse and research coordinator went into the home at the 9-month visit and went over that. So not only was it clearly written instructions and personalized information for report back, it was also done there with a research team member going through the document with the individual to help field any questions and have a discussion and provide what we talked about before, the context for the results. So next slide. And the findings are really interesting. So the full study has 188 individuals, and for this preliminary results, an N of 126 was used. So you'll see which is often typical for studies. This is a little bit more female at 71%, 79% college educated, and a mean of 67. I believe it was plus or minus 6 years. And so some very common self-report changes were allergy covers for pillows and mattresses, using different cleaning products. Those were the most reported from that. They received it at the 9-month, and then at the 18-month, the change could be detected if it was present. An average of 4 changes was reported, which sounds very positive. And then from baseline to 18 months, there was increased use of vacuum cleaners with HEPA filters from 46% to 65%, mattress covers 30 to 82%, and pillow covers 28 to 83%. So very positive preliminary results. And then we saw a nice decrease in the use of store-bought cleaners, which was 75% reported at the baseline, and that decreased to 58%, which I think is an interesting finding because most people are very married to the products that they use and how they clean. And so having that change in the product that you're committed to or you've used so frequently is really exciting. To be able to see some actual change self-reported. Now, of course, in further studies or what we could do to move forward, it'd be nice to see some way of getting some objective data for this, but just in case people are over-reporting what their goal is. But even so, just to have the awareness to know that you would want to reduce these exposures in the home is really a win, I think, in terms of good health behavior change and getting that momentum going for the research participants. Next slide. Okay, so the takeaway for this one, if you're able to provide clear written report back, older individuals have the strong potential to act on this. We're seeing really good positive results to see some decrease in the potential triggers that they have in their home. So being able to act on those results and have that prompt change is very exciting. Next slide. Okay, fourth and final project is just a sneak peek. So next slide. So here are my current research efforts I'm trying to work to get funded. And I just wrote this diagram to show you how I'm kind of conceptualizing and combining some areas that I really enjoy working in. So keeping the youth at the center, I would like to work with adolescents to do some of these report back measures. And through my work with Dr. Polivka, I'm interested in working with adolescents with asthma and have a citizen science component where they can go and collect their own data in their homes. There would be a clinic visit to collect some different samples to have some biobehavioral components and analysis, and also to do a little bit of genomic analysis for particular SNPs that are involved. And of course, when working with youth, we need to consider them a vulnerable population. So making sure that they clearly understand how they're involved and partners in this enterprise, so that we can really think about the ethical implications that are really caring and being conscious of how these adolescents are involved in research, and providing effective report back strategies to have some sort of prompting of health behavior change and a good foundation for health as they move into adulthood. Next slide. Okay, that wraps up the conversation and the review of some projects focused on report back to prompt health behavior change for hopefully good positive health outcomes. Thank you.
Thank you so much, Luz. That was wonderful. You have a very interesting journey, and you are linking every single year of your career actually all together and coming up with new ideas. I enjoyed your presentation a lot. Thank you so much.
Thank you.
Yeah,
Thank you, Anita.
I'll chime in and say, yeah, very nice job pulling it all together. It's kind of hard to do.
Some props out for you, Barb.
Thank you. Not necessary. I do have a question. It was sort of interesting when you were talking about back in the first, I think this was in the scoping review, you talked about the importance of teaching methods. So do you think it's worthwhile when you're doing a grant, this is not something I've done, but to have someone with some data visualization expertise built into the grant?
Yes. Everything that I'm seeing from the National Academies report and Susan Bacon, when I talked to her, Dr. Susan Bacon, and then when I talked to, when I've read research coming out of the Silent Spring Institute, the data visualization and the specific attention to graphing and how it's interpreted with people who have a lay kind of normal understanding of science is really, really important. That's highlighted in a number of areas in both some of the Silent Spring Institute documents and the National Academies document.
So the challenge is finding people with that expertise. Here at KU, we do have one person with that expertise, but it's rare. It's very rare. Yeah.
I agree. And I think that maybe even starting out as an initial step by reaching out to graphic designers could be a great way to start, even though that's not quite the same as data visualization. I think at least it would be a start in terms of having a varied research team that works on that communication piece.
Yeah, I think that's, that just struck me as like, it's not something we ever really think about in our grants, but would be really helpful, especially in this area.
Yes. And I think that NIEHS would respond to that very well when I think about attending that report back conference. That was mentioned multiple times.
Yeah, that's cool. Good. All right, nice job.
Yeah.
Hey, Azita, how are you?
I'm good. How about you?